Hello, everyone, and welcome to this evening's webinar, Extending the Clock Targeting Mitochondrial Dysfunction to Enhance Longevity. My name's Tom Gary. I'm an exercise physiologist and clinical consultant for RehaCare. I'm also a laser user myself, very big advocate for them. I'm going to be your host for today's session. So joining me behind the scenes is Sherelle Paz. She's our marketing manager. She's going to be behind the scenes, making sure that everything runs smoothly. And look, to start off, it's great to see that we have so many people across Australia joining us today, across New Zealand, and even overseas. For us at RehaCare and InnovaMed, that's something that makes us really proud. We pride ourselves on, providing really good education, whether it's through webinars and workshops across all disciplines. So, whether you're a chiro, a podiatrist, osteopath, holistic doctor, the list goes on. This is something that you can really get behind. We're really big on education, and you're in the right place right now. So for those who, if this is your first webinar with RehaCare, I'm excited for you because it's going to really blow your mind. We've got Rob Silverman here to take us through everything. So welcome. And to start this presentation though, just before, if you guys have any questions, feel free to type them in the Q&A box because we'll get to them at the end. So how it's going to work, Robert will start his talk and then we'll do a lot of questions at the end. We're very excited. Robert Silverman is going to join us next year in our big summit in coming in May in the Gold Coast. So that's really huge for us. He's going to be working alongside Brett Jaros, who's a well-renowned neurochiro across Australia. And we're also very lucky to have Brett Jaros with us, joining in on this webinar today. I might just quickly put it over to Brett just to say hi to everyone.
Thanks, Tom. And just from my perspective right now, being based in Australia and I do a lot of travel to the US for a lot of my education, I feel very grateful for when we get the opportunity to have someone such as Dr. Rob Silverman, obviously starting off with these webinars, but also too for next year to be able to have him live in Australia. And any time we get a chance to get the experts in this field, you'll see Rob's name pop up on a number of the different research articles as it relates to low-level laser therapy. So to have someone like that attending Australia, for me to be able to share the stage with him, to be able to help assist him. But as an Australian, I always like having our expert speakers that come from a long distance to try and give them the opportunity for the learners in Australia, or for those that are traveling from New Zealand, Asia, Pacific regions, if they're coming to the seminar next year, for them to be able to have as much opportunity to learn from Rob as we can. And I'll be there in more of a supporting act. So appreciate RehaCare for obviously getting Rob to be able to get here to Australia. And Rob, thank you again for coming out to Australia next year, and then obviously beginning the process with these webinars through RehaCare. So I'll hand it back to you, Rob, and thanks again.
Thanks so much. I really appreciate those kind words, Dr. Brett. I am truly excited and honored to be coming, share the stage with Dr. Brett. Tom's really going to be there also, providing a lot of support. Excited about seeing all of you, sharing some insights that I've had gathered over the last 16 years, clinical, practical insights. It's going to be a hands-on oriented seminar. It's 3 days, more to come. This is just a little taster, if you will. I'm easy to get in touch with. I'm going to leave you some contact information at the end. Don't worry about the catty-cordiness. We set up the camera so you could see my room. You could see the different lasers in the room, and we will have some definitive hands-on. So let's dig in and let's really get to the idea of extending the clock. I want to share some strategies for targeting mitochondrial dysfunction to enhance longevity. Longevity, without question, is the conversation piece of the now. It's not the conversation just of the future. Well, let's see, of course. There we go. Somebody really famous once said, "Let there be light." So I'm a big believer in always doing some sort of cerebellum brain upregulation. So you see Steffi there. She's standing on a rocker board, unstable surface, to try and get a little proprioceptive feed. She's using the body blade, the body blade and trying to get her scapula in retraction. And I'm using one handheld there, trying to laser her cerebellum. Got a whole bunch of different things going on. I'll break it down and get granular and on the whole purpose. But at the end of every particular protocol and every treatment, you should always finish by lasering the brain. For me, and Brett and I will definitely do a panel on this, and we don't have to agree. I'm sure we're going to talk about lasering the brain. He may be a little bit more specific on which parts of the brain, depending on which condition and things of that nature. But for right now, for where we are, laser the back of the cerebellum, laser upregulation. So let's look a little granular. Let's really try and get detailed. Let's not be myopic, but let's look to the future. And what are we going to see? We're going to see, without question, lifestyle is our left hand because, I mean, you guys have a great lifestyle in Australia. I come from New York. We're the leaders in the worst lifestyle out there. Our diet is called the SAD diet, the Standard American Diet. What an awful acronym, if you will. You add lifestyle in the left hand, the right hand is laser. The combination makes for what I like to refer to is a step into longevity with a beautiful white cloud. Longevity is the incisive conversation of 2025. Longevity has been the conversation of 2023 and 2024. I proclaim that non-thermal low-level laser is the device of choice to enhance longevity. So a lot of people say, what is longevity? What's a brisk little answer? Longevity is very simply health span versus lifespan. How long you live, lifespan versus how long you live without chronic disease. I can only give you American numbers in chronic disease, but 6 out of 10 Americans have one chronic disease, 4 out of 10 Americans have 2 chronic disease. It is without question the anchor to our healthcare system. You guys have a total inversion to what we have. You don't have tremendous numbers in reference to chronic disease. But for me, longevity is much more than lifespan versus health span. It's also the concept of vitality. It's a long flight coming from New York and the US of A to get to the Gold Coast. But we're going to do it because we want to come see Australia, of course. We want to present. And I promise you, I'm going to bring as much energy as I have now, if not more in person. I'm going to be able to do that and hopefully more. The concept of vitality at 60 years old, working every day, enjoying it, coming with a specific concept of vitality. So longevity equals little halo over it called vitality. Longevity, or some new longevity studies reveal sophisticated interplay of the following. Genetics. Genetics load the gun, lifestyle loads the gun, but your environment will fire that gun. Epigenetics, your expression of your genes via your environment. Some sophisticated interplay of metabolism, immunity. I believe having a robust, resilient immune system is the key to having a long, successful, healthy life. And last but not least, lifestyle. Lifestyle, lifestyle, lifestyle. If we did one thing, I would tell you guys to attack the idea of getting a good quality lifestyle, work-health balance, work-life balance, proper foods, eating the foods in the right order at a meal, exercise, social encounters, etc. My computer is being a little bad right now. So, for those people who live beyond 90 years, they're called long-lived individuals. They all shared some remarkable traits. One, they had less chronic illness. 2, they pushed back the onset of age-related diseases, and they all maintained better physiological function. The data really indicates that a lifestyle will lead you to 80 to 90. If you want to get to that centenarian, that 100-year, you're probably going to need a little genetics on your side. However, 80 to 90, we're talking a healthy 80 to 90, as opposed to an unhealthy 60, 65, 42, things of that nature. So let's talk about the idea of lasers for longevity. As I said before, I believe non-thermal low-level laser is the choice device for longevity. And I believe that chiropractors, in many instances, are really in that longevity sphere. So when we talk about non-thermal low-level laser and being the example and the answer, well, the real question begs, well, why? Well, laser is without question non-invasive. There's no downtime. There's no pain. In fact, it has FDA clearances for decreased pain and increased range of motion in short treatment periods of time. It has those wonderful pain relieving properties. It decreases swelling. It improves blood flow. It enhances energy production. That idea of energy production is really one of the backbones of what laser does. The concept of mitochondrial function and the ability to optimize the making of ATP and the decreased release of reactive oxygen species. So if you say mitochondria, I'm going to say non-thermal low-level laser. And we'll go into real detail when I come out there. I'm going to show you some wonderful mitochondrial protocols. And mitochondrial dysfunction is probably one of the biggest things that you're going to see in your office because mitochondrial dysfunction masks itself as fatigue, which is the number one reason why people go to the doctor. Anti-inflammatory, the laser performs a lot of anti-inflammatory properties, so much so that you'll see them on blood tests. So for instance, overall, laser increases the interleukin 10, which is a anti-inflammatory interleukin. It also conversely, by increasing interleukin 10, decreases TNF alpha, interleukin 1 beta, interleukin 6, and interleukin 8. I know that was a New York minute mouthful, but the bottom line is applying the laser will decrease inflammation. It has immune boosting properties. I wrote a whole book in 2022 on the immune system and long COVID. And one of the things I used in my long COVID protocol was low-level laser. The green light promotes stem cell production, decreases stress hormones, it's neuroprotective, downregulates stress responses in the brain. If you want to talk about the gut to brain axis, we're going to go in full detail, full throttle when I come out. Laser also accelerates wound healing, upregulates collagen production, and has some great properties for fat loss, cellulite reduction, and skin conditions. So people ask, why? Why would you want to utilize, why would you want to purchase a non-thermal low-level laser? Well, it's effective without question. It's so quick, it's using the speed of light. It's research-driven. Cornea has 22 out of 25 FDA clearances. Now, that may not be a big deal to you there. You may not have an FDA. I know you do have certain organizing bodies, but the FDA is sort of the rule of thumb where we are. Also empirically studied. I'm going to ask a lot of you, how have you liked the utilization of laser in your office? It's practice building. It allows for joint health. It allows for brain health. It allows for gut health, and it allows for neurological improvement. Sorry about that. My computer's got a mind of its own tonight. What is laser? It's actually an acronym. It's a light amplification by stimulated emission of radiation. It's a focused beam of light that emits photonic energy. It's donating a photon. Everybody, photonic energy. All the photons are traveling at the same direction, at the same speed, in the same coherence. So it's coherent light. So look at the top, coherent. Look at the bottom for many other like lasers or infrared lights, it's incoherent. The only way I can describe this is that, have you ever been in a bar with a drunk? They are incoherent. They cannot communicate with you. That's how many other laser companies have lasers, but that's really many kind of just infrared lights. Coherent light, somebody who's graduated from a type school, is wearing a suit and really elucidates in a clear manner where they can communicate with you. That is one of the keys to non-thermal low-level laser, the ability to have coherent laser light. So what are some of the synonyms for non-thermal low-level laser? Well, low-intense light therapy, photobiomodulation. The key effect for the performance-enhancing properties is that the laser should be photochemical and not photothermal. The photon should provide a chemical response, not a heat or a tissue increasing temperature response. Light triggers biochemical changes within the cells. What I like to refer to is, I call it photosynthesis of the body. Every one of your patients will understand photosynthesis. Anytime I have somebody looking a little weird when I'm trying to explain, the light bulb will go off when I say it is photosynthesis of the body, because the photons are absorbed by cellular photoreceptors and trigger chemical changes. So lasers directed to the effective site. We're going to do some hands-on. So if you have some questions or some protocol requests, put them in the Q&A box or the chat box. Tom will share them with me, and we'll get going on them in a few minutes. So directing the laser to the effective light, the photon enters the tissue. It alters the cell permeability. So one thing about cell permeability is the more healthy the cell, the quicker the person will respond. So we'll take the top football player in the world. We'll take myself at 60 and my dad, who's almost 95. Who do you think's going to respond to the photons quicker? This top football player, because their cell membrane's in better condition. I will beat my dad because my cell membrane is in a better condition than my father. So photons enter the tissue, alter cell membrane permeability. If you feel the patient has cell membrane permeability problems, omega-3 fatty acids and alpha lipoic acid, this all leads to cellular photochemical reaction, getting absorbed in the mitochondria, cascading to produce efficient ATP, resulting in increased metabolic activity, vascular activity, and decreased inflammation. Major components that are critical to the beneficial question. Number one is the wavelength. There's 3 wavelengths that we're going to talk about. Wavelength number 1 is going to be the red wavelength, 635 nanometers, starting at one end of the visible light scale. The other wavelength that we use is a green light, 520 nanometer light, and then we get down pretty close on the visible light scale. The violet light is a 405 nanometer light. The dosage should be in milliwatts. The lower the dosage, the better off we are. It's all about absorption, not about depth of penetration. It's about absorption. And the milliwatts dose allows it to be absorbed. The delivery mechanism is coherent. I love movement. You'll see my 635, FX 635 and FX 405. They scan, they move around, and you'll see when I take the handhelds, I just picked up a handheld now, you'll see that I'm always moving it around, and I like the patients to move and pulsing. The frequency of light pulses for musculoskeletal benefit. Continuous has a aesthetic benefit. People are probably surprised I didn't talk about the frequency. I will share frequencies. I have my own frequencies. You'll love them. They're easy to, I have my top 50. They're easy to adapt into your practice, and they're put together in a way that's quite adaptable. So low-level laser basically increased osteoblastic proliferation, bone healing, wound healing, modification of angiogenesis, scar formation, and pain reduction. Mitochondrial dysfunction. I'm a big believer in it. So we're taking a look at a young mitochondria that's working well. The electron transport chain, the inner layer of the mitochondria, should be optimized and functioning well, producing efficient ATP, which leads to a decreased release of reactive oxygen species and oxidative stress, and an increase in glucose absorption. Melatonin happens to be in the particular slide because this is also adding melatonin, which I'm robust on. Then you have the left and the right. The left side, you have old mitochondria, where you have a decrease in electron transport chain efficiency, decrease in ATP, and an increased release of reactive oxygen species. You also have a functional old mitochondria in that you have electron transport chain upregulation, ATP. I want everybody to think about mitochondria like you think of taking home those goldfish from a fish store. You have that little plastic paper bag or that little plastic bag where the water is leaking out. That's how mitochondria function sometimes, because when mitochondria is leaky, it releases mitochondrial DNA into circulation and can cause inflammation. Conversely, inflammation can also be a stressor for mitochondria. It's a circuit loop between these two pathways. So mitochondria, unfortunately, or fortunately, has a myriad of different properties that it can grab and holster. Number one is obviously production of ATP. It's the powerhouse of the cell. It's your energy batteries, but you could also produce inflammation for mitochondria. Mitochondria also helps with immune function. So when you look at functional mitochondria, it's producing ATP and it has growth adaptation. And dysfunctional mitochondria can actually lead to vast inflammation, as we depicted in the preceding slide, and/or cell death. Endosymbiosis for mitochondria. It means one organism can live in another. So your mitochondria can live inside of us. My mitochondria lives inside of me. But if I have a failing, dying mitochondria, there's a break in endosymbiosis. Obesity, processed food, ultra-processed food, I should say, lack of exercise, disrupted circadian rhythms, and environmental pollutants all can lead to either cell death or mitochondria inflammation. Mitochondria inflammation can lead to rheumatoid arthritis, multiple sclerosis, inflammatory bowel disease, and asthma, just to name a few. So what diseases are affected by mitochondria? A litany of diseases. Most of them are aging and neurodegenerative diseases. I'm not going to go through every one of these slides in the interest of time, because I do see some population for question and answers. So we've got over 50 people. Again, if you have a question, if you have a protocol that you want me to go through, put it in. Tom will hold it for me. But let's get to the idea of mitochondria helps secretly fight off bacteria. Again, people don't realize that mitochondria have a immune function. And what's interesting about the mitochondria is they sense bacterial activities and they help neutrophils trap and kill that bacteria. So dysfunctional mitochondria leads to weakened immune defenses. Mitochondria can detect specific bacteria and use the signal to initiate NETosis. Is engulfed, neutrophils can affect the presence of lactate. When the mitochondria's ability to sense lactate is compromised, neutrophils fail to produce NETosis effectively. Bacteria is more likely to escape and capture and proliferate. This is a crucial mechanism to immune defense. I mean, how many people out of the 50 we have, you don't have to answer this, really knew that mitochondrial function helped with bacterial infections? So let's look at mitochondrial biogenesis. There's multiple research that talks about low-level laser improving mitochondrial biogenesis because it stimulates the production of new mitochondria within the cells. So it can think of the idea of mitochondria as batteries. You can recharge a battery, but you can also make new batteries or give yourself new batteries. Laser helps with both of those. And when you make a new mitochondria, it's called mitophagy. The mechanism for low-level laser is believed to interact with mitochondria, directly stimulating to the electron transport chain, leading to increased ATP production and signaling pathways that trigger mitochondrial biogenesis. Non-thermal laser can dampen inflammation, improve mitochondrial function, and optimize our genetic expression to enhance the overall quality of life. The takeaway is laser energy fuels mitochondrial function. So let's take a good look at this particular slide. Let's take an idea of the inner layer of the mitochondria and the electron transport chain. In a nutshell, you need to hit all four complexes to optimize your ATP production. Complex 1 and complex 2, which are the two critical starting points, get stimulated from photonic doning of the 405 nanometer violet wavelength. Complex 3 gets stimulated by the 520 to 532 green nanometer wavelength. And last but not least, the red light 632 to 640 stimulates complex 4. When you stack two handheld lasers or stacker FX635 or FX405 and a handheld, you're now going to get full mitochondrial function. And I know there'll be probably some questions on that. The basic premise of this slide is that you need 1.7 photonic energy to stimulate 1.7 electron watts to actually jump complex to complex to complex. When you're at about 650, you can generate about 1.9 electron volts. When you get to about 700 wavelength, there's not enough photonic energy to stimulate the complexes. And the real takeaway is the lower you go down on the visible light scale, the more photonic energy. So with the lower the wavelength, the more photonic energy. So the GVL, the green and the violet combination, which I did an FDA clearance for, is the most energetic laser in the world. So here's some wavelength properties: 635 nanometer mitochondrial activity, prolific activity, production of interleukin 10, which we talked about before. The 405 nanometer light is reduction of apoptotic cells on fibrous tissues. It improves breakdown of scar tissue due to high electron volt, antimicrobial support, stimulates VEGF. And here's the takeaway of the day. The 405 nanometer laser has a positive effect on releasing fascial tension. So if you have that fascial winding, and we'll go through that when we come out, musculoskeletal injuries over duration of time, scars and things of that nature, the 405 nanometer light is a must. The 520, which is one of my favorites, the green, has been shown to facilitate nerve regeneration better than the other wavelengths. The red is also positive. It's the biggest stimulation of stem cells. It is improvement of fibromyalgia. It promotes immune function. It reduces oxidative stress. And Harvard University speaks about the 520 nanometer light as the go-to wavelength for headaches. I do a lot of functional medicine. I'm a big believer in all health begins in the gut. It is the epicenter of your health. 80% of immune cells are in your gut. So when you utilize the violet light, you're going to be ameliorating to attenuating viruses and some bacteria. The green light will take care of the bacteria mostly and some fungi, and parasites will be taken care of by the red light. So once again, the stacking, the utilization of two handheld lasers or an FX and a GVL will allow you to have an outcome in your functional medicine toolbox that's bar none. I wrote an article for Chiropractic Economics. It was about laser therapy for mitochondrial dysfunction, the use of non-thermal low-level laser across 3 different wavelengths simultaneously is an exciting new development for treating mitochondrial dysfunction. Here is a nutritional protocol for mitochondrial dysfunction to increase the production of mitochondria so you can decrease fatigue, NAD, B vitamins, coenzyme Q10, acetyl-L-carnitine, alpha-lipoic acid, creatine. You could probably make that creatine 10 grams a day. Taurine, serum bovine immunoglobulin, starting from the bottom right, is the mop of the gut. Vitamin C, selenium, zinc, magnesium, and liposomal glutathione. So it is demo time. So let's dig in. Tom, do we have any pressing questions before I demo? Demo time.
There are a few questions, yes, if we want to answer some now.
You know what? Let's hear it.
Okay, so the first question here is, do you have any concerns about far infrared heating devices for cold complex regional pain syndrome? And if you're giving these to patients if they are traveling and at-home use?
I don't use any far infrared lasers because I use them, and please don't be insulted when I say this, I use them to heat my sauna because they have a great ability for heating. So I would probably not use them for the condition that you mentioned. I would probably pass. I would much prefer, much prefer. And I will make a note that the next webinar we come on, if I do one protocol, because it's going to be more Q&A, I will do a protocol for that specific question that you asked. I would much prefer you utilize non-thermal low-level laser, like the Aconia lasers.
The other question, Rob, is how does non-thermal laser decrease free radicals?
It's a fabulous question. It decreases free radicals by allowing the mitochondria to function more efficiently, better ATP production, hence less reactive oxygen species production. So it's like if burning efficient gas in a car, you don't have as much exhaust.
And how many days a week, Rob, do you use laser therapy on yourself?
Every day. Every day. I need it. I switch off lasering my brain and my gut, and every day I laser my vagus nerve, which is something I will show you when I get there. You guys are going to love my vagus nerve protocol. Absolutely. It's just that we have confines of time on a webinar. We want to stimulate interest. We want to support you now and between now and the time that I get to Australia in May.
Well, quickly, we
Anybody
just got
else?
two more questions before
Sure.
you go into your demo. So one of them is where if someone wanted to read about the 520, the green laser facilitating nerve regeneration, where would they go?
I can send over a slide to Miss Paz, and she can
Yeah.
share it with them.
Yes, I'll share that on the follow-up emails. Thanks, Dr. Rob.
No problem. The voice from somewhere.
Yeah. And the last question here, I think they maybe mean high power. They're saying, what do you think about high intensity laser therapy? Maybe they're meaning power.
I guess they meant more, yeah, I think they mean more power. So
Yeah,
more
high.
power, typically wider wavelength. The reason they do more power is to push because the wavelength is further. I think they get too high in joules. I think the secret sauce is that we're using a coherent light with low power that has a line generated beam. I think most people don't realize your cornea laser has a line generated beam, and it's mimicking photosynthesis and having a photochemical response. You don't want a photothermal response. I mean, here we are, think about what heat does. And heat can have some deleterious effects, and we know that. So if you heat a brain too much, it generates a fever. You probably wouldn't want to heat an acute condition. You probably wouldn't want to heat a nerve, and you would probably want to heat a chronic condition. So let's be fair. However, all of those scenarios are viable for a non-thermal low-level laser. So, tipping the scales in their favor, if you will. Do we have any other quick questions?
I think that's it for now, Rob. So yeah, we
Right.
can still answer any remaining questions at the end. Thanks, Rob.
Right, terrific. I just noticed they were populating and sometimes people weren't able to stay on. So I'm going to do some hands-on now. So here we go. So I've got my lovely friend Rebecca, and hold on, let's sit you back. I want to see that I can see you nice and clear. So I call it, this is something that you can do with all your musculoskeletal conditions and musculoskeletal patients. I say it's as simple as 1, 2, 3. So number one, you point and shoot. Number two, you're going to use passive movement, which obviously the doctor, I'm going to move her, let's say her shoulder, and then there'll be active movement. I'll have her do that. So let me grab a GPL, which is my favorite handheld. It's the Mercedes, if you will, or, when I was in the UK, I called it the Aston Martin. And let me load it up. All right, so she has a right shoulder issue. I know it's chopping my head off, I'm sorry, but it's okay. My wife says that's my better view. Okay, so point and shoot, I'm just gonna laser her rotator cuff. And you could take a stand and hold the stand and just laser right in there. Then we'll just move her into flexion. I just hit. So that's point and shoot is number one. Number two is passive movement. Now, why do you do passive movement? You do passive movement because you want to check that she can passively move. Number two, you also want to engram a proper movement in her brain. And number three, you want to be able to have some active motion. So I'm just going to have you raise your arm up. Terrific. And then you can move the laser around. I don't usually keep it stationary. Go ahead, do it again. So simple as 1, 2, 3, all specific areas. Number one, point and shoot. Number two, passive movement. Number three, active movement. Are there any questions on that? All your musculoskeletal needs should be addressed with this, so you have a simple system.
Someone was just asking if it's okay to do over clothing.
I'm doing over clothing with Rebecca. Yes, it is always superior to do it on the skin. However, that's not always viable in a practice. So there's a little scatter, but you have billions and billions of photons being emitted with this laser light. So as long as one gets in to stimulate the cascade, you're good. There is a scatter.
Yeah.
It would be better, but to get skin, Rebecca's a young, pretty girl. It's going to be hard to work around it from a male practitioner, so it's not always going to work. Any other questions on simple as 1, 2, 3?
Oh, there was one question, just talking about her before and after, raising her arm. I think is that all she can raise her arm, or is there, I think they're up like
Raise your
asking
arm up,
about
yeah,
before
so
and afters.
I'm just using her as a demo. I didn't
Yeah,
tell her
no.
to give me a fake injury or anything like that. So she can raise her arm above her head.
Yeah,
Okay,
cool.
so she put it down. So now, next step is you can add some tension to it. So for instance, I did 1, 2, 3. The fourth one was try and raise your arm. Resist, 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 resist. So you could add that. I could add a band right here and put the imaginary band that's in the other room, and I could resist her. So that's something you could do. And last, this is critical. Could you stand up? I call it laser motor lock-in. Are we able to get it or? Oh. So laser motor lock-in. I'm going to be here. I'm going to have her walk in place. Move your arms back and forth. Just walk in place. And I'm going to get her out of the way. And so you can see, I'm going to laser the spinal cord and the back of the brain. 5 seconds, spinal cord. 5 seconds on the cerebellum. I'm pressing the save button. Now, what do I mean by that? I'm pressing the save button because the bottom line is every time that you do a treatment, you want the brain to remember that treatment. My wife, I hear her voice right now literally saying, if you work on a PowerPoint, please press save because otherwise you can lose everything you did. Same thing. So eyes open, stand in place, close your eyes now, and laser the spinal cord and the cerebellum. So 5 seconds spinal cord, 5 seconds cerebellum, eyes open, eyes closed. You can stop for a second. You can also, if you don't feel that you want the person to walk in place, please stand up on your left leg. I'm just arbitrarily picking one leg up. You probably can't. Oh, there she goes. Terrific. Sorry, they were questioning your range of motion. I was not. RehaCare. Okay, switch sides. Oh, that one doesn't go up as much. Oh, we found a weakness here. So after every musculoskeletal treatment, please do laser motor lock-in. So I'm gonna have you sit. Any questions?
Rob, there was one other question. Someone was asking for duration of time. Do you
Great question.
generally split up time, say for the different phases? You have the set it and forget it, the movement phase, the phase when you're going against resistance. How much time do you dedicate to each phase when you're lasering one particular part?
And I love the idea of set it and forget it, because it's easy, because I can set it and forget it. Again, I can just put it here. For me, if I'm in the room and I'm doing all 3 phases, I'm very quick because it's more of a whisk for an ATP production. So whisking, like 2 minutes per phase. So 2 minutes for, if you will, point and shoot, 2 minutes for passive movement, 2 minutes for active movement. That would be it. And then, X amount of seconds to upregulate. Or you could move that. Heck, yeah, please. So I happen to be using the 635. I have the 405 in the corner. It's just the position that we have it in the room. Now, here's what's interesting. I can set it and forget it and talk to you, Tom, and you can go get me the coffee, and I can explain to you how you can get a New York coffee, and I can use the accent and all that other stuff. Or I can passively move her and shoulder abduction. And then she can do it on her own. And while she's doing that, I can also simultaneously laser the brain. And maybe the big ticket item, maybe the secret recipe to success is stacking. So I can stack it with a 635 or FX 405. We can stack the GVL and it can get all three laser wavelengths and it can point and shoot and set it and forget it and leave. So this is one way of stacking where you take two different laser items, and with these different laser items, you expose all three wavelengths to the patient so they can have optimization of the electron transport chain upregulation. Any questions on this? We call that stacking. You can also stack with two handhelds.
So, Rob, there is a good question here. Someone's talking about how the light is penetrating the skull, going into the brain.
You mean, is it penetrating the skull, or is that, was that?
Sorry, is it penetrating the skull?
It is penetrating the skull because it's being absorbed. I know you're thinking because it's a big, thick, hard bone, but we have multitude of data and research stuff with Alzheimer's, autism, ADHD, where we're making an effect on the particular brain, different brain waves. So it is. It's not a direct penetration, it's an absorption. Remember, we talked about absorption before. Do we have any other questions?
The last question here, Rob, is someone was just worried that if an abnormal pattern has been identified, would it be safe to laser, as you might be locking in an abnormal pattern to the brain?
And so that is an outstanding question. So I've never seen that happen, but I think that the whole idea is always going through and lasering the brain last. So you asked me, do I laser myself every day? Yeah, I laser my brain. Yeah, I don't eat popcorn to laser my brain. So I have congenital torticollis. So if anybody's wondering, I have congenital torticollis. So it's a lateral deviation to the right side and lateral flexion and a contralateral rotation to the right. I've had it for the 60 years of my life. So for me to go in and laser, I still, laser my brain, I still get a positive feed. I'm in flexor tension, so I'm rounding, I'm coming forward too much. I actually, before I laser, I stimulate my extensors by walking backwards. So I do some work before, and then I like to laser my brain. That is my preference. That's my little nuance to the idea of lasering the brain. So I like to end with lasering the brain. So that's a great question. One, believe it or not, that I've not been asked in the US.
Yeah, well, I think just while we're on the topic of lasering the brain, someone asked, should you part the hair to get maximum absorption?
I think that's a fair question. I think that what I've seen, that it pierces and once again gets absorbed. I think you're thinking that hair and bone is a deterrent to laser absorption, and it's not. Because is it better if the skull is exposed? Sure. I mean, think about somebody who's bald and somebody who has hair. You can still get a suntan in your hairline without question. Obviously quicker if you have no hair.
And last one here, Rob, is there known side effects for an overdose of laser?
That is an outstanding question. So the studies have shown that because it's non-thermal low-level laser, there's no heating. It would require, I think, 440 minutes of direct exposure. However, because we're using a pulsed wavelength, it never gets to direct exposure with an cornea laser. So that's an excellent question. So you're not going to do too much. This idea of the hormetic threshold or hormesis doesn't really pertain to a non-thermal low-level laser. It pertains to sauna. It pertains to cold showers and ice pack dips. We're trying to read the question, but it's a little too far. I don't have my eyes in. Let them read it. Tom, I see there's another one.
Oh, there's another one up there. I can't see anymore. I think that was the last.
Okay. So let me laser the gut for Rebecca. So that's Okay, you go. Okay. Yeah. So I'm lasering her gut. So you'll see me do this often. You'll see me do this with my nutrition patients, my functional medicine patients. Basically, I try to laser everybody's gut if I get the opportunity. So I have a specific frequency that I use the gut, and my master gut, you guys can write it down. It's in the notes because we're going all camera, no notes, is 4, 4, 9, 26. My master brain is a little different than Dr. Barry's. It's very close. The one that I use is 1, 10, 13, 40. 13 is shown to be very effective for cerebellum. So laser upregulation, you're going to make sure you have cerebellum in there. And the rest you guys will see when I get there because I'm going to have a whole plethora of different frequencies and different phases and things of that nature. How are we doing on time? I want to make sure that I don't show. Oh, yeah, we got plenty of time. Tom, do we have any more questions or should we do another protocol?
Yeah, that's it. That's it for now. That's all the questions for now. I'm sure there'll be more coming towards the end.
Right. Well, while I'm lasering her stomach and her gut, interesting. These were questions that were sent in before. How does laser help cell function? I think we discussed that in the idea of mitochondria. Chronic fatigue, perimenopausal issues, and related energy levels or reduced energy levels. Well, obviously, chronic fatigue comes from a decrease in mitochondrial function. Why do perimenopausal women have so much fatigue? Perimenopausal, loss of estrogen, loss of estradiol, a main type of hormone coming from estrogen. Estradiol decrease adversely affects mitochondrial function, so you'll have mitochondrial decrease. Protocols to help improve performance as well as understanding the body's mechanisms. I'm going to share those with you, but I think one of the big ones was there was a 2016 study, an Olympic type event, where people were using a laser just like Zirconia, and they decided to ban the laser because if everybody didn't have access to it, they felt it was giving athletes an unfair advantage as if they were taking steroids. I think something popped. What do you got?
Let me just quickly read. No, I'm trying to read. No, there's no.
Oh,
Still no.
it's on the Q&A, Tom. It's what do you do for tactile allodynia? I'm sorry if I mentioned it or pronounced it wrong.
No, you did
Pain
it.
to
You did
normally
it.
painful stimuli.
Great question.
Oh, there it is.
Yeah, that was in the Q&A.
Yeah.
So I would definitely do inflammation in a specific area. There'll be an inflammation protocol that we'll share, frequency protocol. I would also use one for a nerve, and the peripheral nerve is 2. When I say 2, it's the frequency of 2. And nerve root, if I remember correctly, is 493360. So I think if you did 3 to 5 minutes of each one of those particular, I think you'd be very happy. Now, again, 80% of your immune cells are in your gut. Your gut has your largest immune system in the body. It's called the enteric nervous system. So that enteric nervous system enables you to do a multitude of things. Your gut will communicate with your vagus nerve. Your vagus nerve will communicate with your brain. Your brain's part of your central nervous system. And you can see the interconnection and interworking of the body. And laser helps you connect that interconnection.
And Rob, before I go to the next question, there'll be a little interactive poll that will come up on the Zoom screen there. If people can just tick on the screen for their selection, that'll just show like their topics of interest. That'll just help us before we wrap it all up. So if you can just tick on, what matters to you, you can choose 3 choices. That'll help us out there too.
How's your gut doing?
Been great.
One little question here, Rob. Would it help for cervical central stenosis?
Well, it's not going to, the stenosis, what's stenotic? Is it the bone? Is it the disc? What do we have? However, it will decrease the pain and increase the range of motion. So I've had a lot of patients with cervical and lumbar stenosis be able to avoid the knife because of the laser. And then look, the bottom line with the laser is it's a great standalone device modality. However, it works synergistically with many other types of treatment protocols, so in your instrument manual, if you will, instruction manual, laser should be the device of choice. Could you mix it with shockwave? Absolutely. Could you mix it with acupuncture? Yes. Could you mix it with chiropractic adjustment? 100%. Could you mix it with kinesiotaping, exercise rehab? Absolutely. Again, so it's a great standalone, but it's also great because it's synergistic with any other kind of treatment modality. So how's that survey going, guys? So Tom wants to know how we're doing so far. So if we're doing okay, either put a Y, yes, or give a thumbs up right in the Q&A or the chat box, whichever you prefer.
Another question has just popped up, Rob. What would you recommend for an entry-level product?
I'm pausing for thought. I mean, it would be a handheld. My choice is for a handheld. And when they say entry, beginner, stuff, or is it a price issue? I mean, what are we talking about? So my entry level would be a handheld. My choice handhelds would be GVL1, EVRL2. I did the FDA clearance on both of those, and the Accelerate third. Any one of them is going to get you started on a laser healthcare system in your office.
Yep.
Okay.
We've got 60% of people answer the poll. Do you want me to share the results, Rob, or do
Yeah,
that
let's see what they
after
got.
Not a
We have them.
problem.
Good.
We do have a wide, broad audience base today, and that's why this was quite interesting to ask people. So if anyone wants to hear more from Dr. Rob in his next webinar that we have for March,
So it looks like
this gives us an
musculoskeletal is
idea
number
on
one.
which one would resonate best.
Musculoskeletal one, number two, gut to brain, and which is a close second. The one that's coming at the back was the nutrition. Interesting. I wouldn't have guessed that. But let's move on. Rebecca, please. Let's have a seat and let's laser the young lady's brain. Siéntate. So I can simply laser her brain. Now we know the amount of lobes. I like to make it easy for introductory laser owners. So please don't jump all over me. Everybody knows who Elvis Presley was. The famous Elvis haircut. Well, the famous Elvis haircut you take from the forehead all the way back to the back of the head. And you laser the brain. I'm keeping it very easy for everybody. And I think you all get the point. So number one, do the Elvis. Number two, do the hair comb over. All us guys getting a little older want to cover up the little spot. We want to make sure the grass can cover the ground. And we go from left to right. We comb over. Left to right, go back right to left. And you cover the whole brain. Or you can very simply. Can you help me, please? Mm-hmm. Thank you. Keep that on. There we go. The young lady is gonna.
I'm well trained.
As you can see, everybody can apply the laser.
Ugh.
All right. Back a little bit. Get you locked in. Terrific. So now we've got the 635 and the 405, pending on what you have, lasering the brain. And once again, we can stack the lasers. I'll stack from this side. And Tom, do we have any more questions?
Yes, we do. Yeah.
They're on fire with the question.
So there's a lot of questions coming through, which is great. So one person said, out of the 3 levels of entry level products, I'm guessing that entry level products, what one would you choose for treating CRPS, fibromyalgia, and autism?
GVL.
Yeah,
Was that a quick answer?
that's great.
By the
Yeah,
way, autism, 90% of people that have autism have a gut problem. So you have to make sure that part of your toolbox incorporates a gut protocol that I just shared.
and can a high-powered laser be used for the same purpose in low dosage for the brain?
I mean, I wouldn't use anything that's going to raise the temperature of the brain. So I would have to say nay to that.
Yeah. And another person that says, do you have any recommendations for general use for children? No injuries, just general growth and development.
Question. Wouldn't want to do it for performance. I'm a big believer that if you see the 3 phases of care, it's really acute, subacute, and performance and wellness with a black cloud of chronic. So to answer your question is, I would use it on a child. We have no children, but I would use it on a child for performance. I use it on myself for injuries, old age, if you will, and performance.
And another question here is someone saying, do you need protective glasses? Because they're surprised that she's not wearing protective glasses.
Well, we wanted to go out on workers' comp. No, the joke is, no joke. She doesn't need them because it's a class 2 laser and the blink reflex protects it. However, we do have them and she can simply just wear them. So if it wasn't her, somebody who worked here, we always put the glasses on people just so. I live in New York. I live in the most litigious state in the United States. So I almost want to put goggles on from the first time they walk through the door, much less get on a laser. It's my world.
And that's all the Q&A for now.
Okay. So no questions. This is brain. Now I can also take out the GVL and laser her gut simultaneously as the FX 635-405 is lasering her brain. We're getting the gut to brain axis cooking here. How are we doing on time? I want to make sure that I don't know.
That's well.
See you.
And if you really want, would you hold that in by your gut? Yeah, there you go. So Rebecca's lasering herself. There's a couple other really, really good questions. Interesting. They wanted some specific outcomes. If I could discuss specific outcomes for autoimmune dysfunction, arthritis, musculoskeletal injuries, and celiac. Well, musculoskeletal, we showed you the 3 phases of care. There is a great study for joint replacement. There were 70 people in the study on joint replacement. They needed bilateral joint replacement because they had tri-compartment damage, and they needed that joint replacement in the knee. The left side was used a sham laser, and in that sham laser, they did physiotherapy. In the physiotherapy, there was 15 out of 70 knees that still needed joint replacement, which is great. So physiotherapy, physical therapy, whatever term you use works. However, the right knee got real laser therapy, physiotherapy, and it's fine. And 69 out of 70 people did not need joint replacements. So it was 15 times more effective than just physiotherapy alone. Celiac disease, I've seen some great results. Laser the gut. I will share when I come. C. diff, SIBO, CFO, all those different protocols. We'll really delve into that. I'll even share some nutritional protocols with you. And as far as immune dysfunction, we talked about the mitochondria. I have a long COVID protocol that I will share with everybody. Tom, it looks like you got a question for me, or we're at the bewitching hour.
Well, this question I can answer. Someone's just asked, will this whole video and the protocols be up, and emailed later on? Yes, they will. We was a recording and the slides and the notes after this as well. So there will be a little survey as well. If you guys could fill that in, that'll be greatly appreciated, because that helps us moving forward with this type of education.
So did everybody have a good time? I mean, do I get a thumbs up?
Yeah, I think definitely. Rob, we just want to say a massive thank you for coming on and doing this for us. You're a wealth of knowledge. It was very fascinating, incredibly insightful. So thank you. And to have someone like you on there, you've been using lasers for quite some time now, like changing a lot of people's lives. So that was really great. A few closing notes, guys. Like I said before, please do that survey. You will get a certificate by email and the recordings. So that's great. Looking ahead, I know this is really exciting. So we do have some great things coming up. So we have a webinar with Dr. Rob Silverman. Again, this is on the 4th of March. He's going to go through all things laser, cracking the code. And we do have a big seminar coming up as well. This is with Brett Jaros. He was on earlier in Australia. So he's going to be in Melbourne on the 14th of March. He's also going to be in Auckland on the 25th of July and Sydney in the 19th of September. So they're the dates there. Please write them down. The big one that I want everyone to know about is going to be the one we were talking about at the start. It's going to be with Rob and Brett Jaros. So that's our Integrative Practice Summit. So that's a 3-day event at Gold Coast. These things, let me tell you guys, these workshops, if you're very interested in laser, you're looking to implement it into your practice, these things are a must. They're so hands-on and they're just the best information you can get, because a lot of things out there, especially with laser therapy, there can be a lot of misguided questions and it can be quite confusing. If you're someone trying to research it, go online and you can find so many different opinions. So this is what tells you basically fact for fact, everything you need to know and everything you need to know to implement into your own practice. Because whether you like it or not, laser therapy is not going away. It's growing, it's growing, it's growing. What they're doing in the US is huge. Australia is a little bit far behind, but I think as Australians and practitioners, we need to jump on and start using this tech because it's seriously changing lives.
Well
so
said.
for everyone, thank you for joining us. Rob, a massive thank you again. We're very excited for these future events coming up soon, and we'll see everyone later.
Let me know what you guys need. I'm here to help.
Awesome. Thanks, Rob.